In this video, I'm going to be covering the proper order of operations in successfully treating and getting long-lasting results in any musculoskeletal injury. I cover the following in this video. Number one, what are the only structures we would treat directly as manual therapists? Number two, the proper steps to successfully treat an injury. Number three, what each step in the process includes. And lastly, why neuromuscular-based treatments are ineffective and dangerous. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I'm also the creator of the Peak Method and the founder of the Soft Tissue Treatment Revolution, where we teach self-employed and overworked massage therapists a better treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid that dreaded burnout, and help a hell of a lot more people get out of pain. All right, so following a proper order of operation is the key to successful injury resolutions. I'm going to cover a lot of that this time in this video. I've covered this topic before in the past, but I wanted to revisit it again. I get a lot of questions about like what I think about certain techniques or certain treatments or how to manage a case. And what I want you to understand in this video is having a concrete path, an idea of what's going on, what to do in the right order so that you can get more predictable results instead of like always trying to try a bunch of stuff and see what happens, but knowing exactly what you're treating and you can get the results every single time. And it can help you better as a clinician and also help your clients get better results. So let's get right into it. All right. Before we get started in the presentation, I just want to cover a very important idea about the 7 structures that cause a musculoskeletal injury. You know, there's only 7 of them. A lot of people say to me, well, what about all these other things? When you look at a musculoskeletal problem, and that's what we do as soft tissue providers, as manual therapists, we treat musculoskeletal injuries. There's only 7 potential problems that we would treat as a provider. The first one's going to be a bone problem. Next one's going to be a cartilage problem. Next one is going to be a disc problem, then a ligament problem, then a nerve problem, then a soft tissue, and lastly, tendon. So I break this down a lot in other presentations where I talk about all the factors that are involved in an injury and understanding that. And this list really has 2 of them. It's the idea of like structure problems and then tissue problems. So you might say to yourself, well, I don't treat the bone, I don't treat the cartilage, I don't treat the disc, I don't treat the tendon. That's left more for like the surgeons or the chiropractors and everything like that. Yes, you don't directly treat those areas, but when you treat the soft tissue around that, which is in the ligaments, which is in the nerve entrapments, which is also in the soft tissue, which could also be the fascia as well, it's going to take the pressure off of the bone problem, the cartilage problem, the disc problem, the tendon problem. I always say to my clients and whenever I educate people, think of like a bone problem. Maybe they have bone spurring, maybe a cartilage problem, they have cartilage tear or a slap tear or a labrum issue. Maybe they have disc degeneration or herniation. Maybe they have some type of tendon problem in there as well. That is like their thumb stuck inside a car door. The car door is all the bad tissue around there in the ligaments, in the nerves, in the soft tissue. You can't give this a chance to heal up until you remove that. So understanding that these 7 problems are present in the clinical evaluation is going to be really key. We also make a big mistake as manual therapists of thinking everything is just a soft tissue related component and we only focus on that. And then we miss a lot of things because if you have a client that has really bad discs or really bad cartilage and you treat them and then they go do a bunch of dumb stuff in the gym and beat their bodies up, it's going to cause a lot of issues. So your idea and your job as a clinician is to identify all of the variables that are present in that injury and what's going on so you can educate them as well about what to do. Because in the most basic sense, when we look at an injury, I always talk about it's like a teeter-totter. On one side is load, and on the other side is what's called capacity. Load is what they do, capacity is what they can take. So when an injury happens, load exceeds capacity. So your job as a provider is to increase their capacity so they can do more load. But if they continue to do more load as you're fixing their capacity, they're not getting any better. So half of the battle as a provider is, yeah, providing amazing soft tissue-based treatments to break down these bad tissues. But you also have to educate and communicate to the client effectively about what they need to do in between the visit, what they need to not do to allow a healing environment. So let's get into the order of operations. Number one, let me move my head up here a little bit. Number one, restore range of motion. When an injury occurs, there is going to be limited range of motion, and we need to restore that motion. The number one cause in the human body for decreased flexibility, pain, and weakness is an accumulation of scar tissue, also known as adhesion. So what happens here? So what is the scar tissue formation? So basically over time, when the muscle gets overused, it doesn't get enough blood flow, it doesn't get enough oxygen. It creates what's called a hypoxic state, where the muscles don't get enough oxygen, sends a signal to the brain. And the brain goes, oh, there must be an injury there. So what it does is it starts to pump out these immature collagen fibers, and it starts to lay it down inside the muscle. Over time, that scar tissue gets bigger and bigger, causes decreased flexibility, weakness, and pain. Now, I know a lot of physical therapists out there and other providers will, they'll say this thing like, oh, that's impossible to treat adhesion. You need superhuman strength. They always go back to the same study where they looked at something in the fascia of the foot and says it needs like superhuman strength. They don't understand that it's different in different areas of the body. So your first job is identifying where that restriction can happen. So one of the areas where we do find a lot of scar tissue formation, especially in chronic injuries, people with bad postures, overuse, is in the ligaments. The ligaments get stretched out. They develop a lot of that scar tissue in there. The way I like to treat the scar tissue in the ligament is usually using an instrument-based type treatment. I do use some manual treatment as well in the shoulder capsule and other areas in the body where there is that ligament buildup. Next area where that scar tissue can form is in the nerve, and it creates what's called a nerve entrapment. So nerve entrapments are very important, often very misdiagnosed by a majority of providers out there. So that scar tissue starts to form, and over time it gets bigger and bigger. And when it gets bigger and bigger, eventually it gets stuck to that nerve and creates a nerve entrapment. Nerves are built with about 15% of extra slack to keep the muscle healthy, and then eventually it gets stuck inside of there and creates some numbness, aching, burning, and tension. Another thing that happens is when that nerve entrapment occurs, everything around there tightens up in a protective way. So when people are like, oh, I'm just always so tight, I'm always so tense, my muscles aren't firing, it's because the nerve is entrapped. I covered in detail all the upper extremity nerve entrapments that you could have on a past video series. If you're watching this on YouTube, I'll link it up top here so you can go back and watch all that if you really want to dive in and nerd out about nerve entrapments. Next area where we're going to find it is in the soft tissue, which is going to be in the muscles. I also include the fascia in there as well. A lot of people reach out to me and they're like, do you treat the fascia? It's the most important thing to treat. Yeah, it is very important to treat. It's not the like one thing to fix everything, but I do some fascia work as well as I get in there deeper on the muscle as well. Now, in order to treat the scar tissue and remove it effectively, it needs a couple components. The first one is it needs proper depth on the tissue. You have to be able to find it and find where that restriction is. When the scar tissue is present in the muscle, it kind of has like a decreased flexibility and compressibility on there and almost feels like a brick wall. It isn't like a trigger point. And a lot of people say, oh, it's trigger points as well. No, it's not the same thing. Trigger points are actually more of a response in the muscle to it getting overloaded. It isn't any different than the muscle. It's just a response, where scar tissue is actually a physical chemical change in the muscle. So that's the difference in there. So you get that proper depth, then you get proper tension into that scar tissue, where it could be on the muscle, on the fascia, it could be on the nerve entrapment. You get proper depth, then tension into that. Then you have the client go through a full range of motion. As you do that, you're creating more tension and more friction. That's breaking down that entrapment. Now, when a lot of people look at it and what I teach and what I show, on the surface, it does look like myofascial release or even pin and stretch. The problem with those techniques and those treatments are they're actually too compressive. They compress the tissue too much, and then they don't generate enough tension, and the tissue just gets trapped. And it hurts like hell, when the client is getting the treatment. You think you're doing something, and all it's doing is creating like a temporary change in the muscle. It's not actually breaking down that scar tissue. So it's all about fine touch and getting the depth and tension just right, and having that precise and precision treatment really makes a big difference. Step two, once we've restored as much range as possible, here's the thing. If there is a lot of that degeneration and that cartilage damage, maybe a disc damage or tendon damage, we're not going to get all of that range of motion back. Our job is to try to get back as much as possible and remove as much scar tissue as possible. Then we need to balance the strength, because when we remove that scar tissue, you're kind of left with this gaping area of tissue that's opened up, but it's not healthy yet. And those collagen fibers haven't got a chance to realign and get in a better place. So in the corrective phase, we tend to do more of like a corrective type of exercise where it's very isolated. We tend to do more like body weight movements, or very minimal weights, where we're really just going slow and deliberate with these type of exercises. We're not trying to get sore or work up a sweat. We're really just trying to establish some new movement patterns. That's when the balance strength comes in. So I always say the first one, restoring range of motion, think of the injury as like a bad house, and we got to go in and like tear it all back down, then start to build it up. So we tore it all down with restoring the range of motion. Now we're going to start to put the siding on the house. That's going to be the balance strength. Step three is we need to increase overall strength. Once we get that corrective nature in there, the muscle's functioning better, it's more healthy, it's more stable, then we do more compound movements, which are like we use more force, we use more weight. We're really working the entire joint complex instead of just isolating one area. In this type of process in here, soreness is actually a good thing. We want to see some soreness because the muscles are starting to work, starting to fire better, in a better place. And it's okay to be physically tired from it as well. This is the third step. This is when we start to put the roof on as we go there. Now, where they got it really backwards, especially in the musculoskeletal treatment model, is we come in and the muscle is tight and weak, and we want to stretch it, and then we want to strengthen it. But the thing is, the muscle is not healthy. If we do not fix the tissue first and we do all these exercises, it's going to be counterproductive. So when people start off with physical therapy, when they have an injury, they usually don't do too well, because that tissue doesn't need more force and strain on it. It needs to be healthier. And then the last step, we need to retrain the neuromuscular system. But here's the thing, only if it is actually needed. Now, as I said in the intro, neuromuscular treatments, they're not treatments in any sense. And providers that use these tools, it's actually dangerous to the client in several aspects. Now, I know a lot of people will get mad at me and say, I'm a neuromuscular specialist. Here's the thing, you've been sold a lie, and you're actually playing a trick on the tissue, which can be a bigger problem. Here's something I want to cover on the next slide. So I don't know if you know this guy, but his name is 𝘵𝘂𝘍 𝘠𝑗℉, real smart dude. A lot of cool stuff he came out with in like the 70s and 80s. He's basically considered the father of the neuromuscular treatment movement. But he has a quote that says, respecting the approach of motor learning, any dysfunction in the periphery should be normalized first. So what is he talking about there? He's saying, it's not an actual brain problem. It's not a wiring problem. A lot of these neuromuscular people, they will say things like, oh, it's not firing correctly, or the muscle is inhibited. And they think it's a brain problem. They think they need to retrain the brain to fire correctly. Here's the thing. The body doesn't just randomly shut down muscles or not have them fire just out of random things because there's bad wiring in the brain. What's going on is there's a problem out there in the distal tissue in the periphery where issues are happening. And what that problem is probably scar tissue formation, nerve entrapment formation, and problems in the ligament. So when that stuff isn't working correctly, the body downgrades the motion on there to protect the area. And especially if the nerve is compromised, it's going to try to unload that area as much as possible, because if the nerve continues to get compromised and continues to have problems, it's going to put you in a really, really bad spot, and it's trying to protect it. So why is this stuff dangerous? Well, a lot of the neuromuscular treatments, and as they approach things, what they do is they get the brain to kind of shut down that protective tension that's going on. So it's protective tension because it's trying to take the pressure off of the area. So let's say that maybe you have a client that has like a nerve entrapment in the shoulder of one of the brachial cords. They also have some cartilage damage. So what's going to happen is those muscles aren't going to fire correctly. You might see a postural distortion to take it around there. So if you go in and you like retrain that area and you unload that postural distortion and temporarily the client feels better. Here's why they temporarily feel better. Anytime you stimulate what's called mechanoreceptors in the muscle, they start to fire. And when they fire, they go up this track called the lateral spinal thalamic tract, which also senses vibration and pain. And what that does is it just blocks some of that pain so you don't feel it as much. The best example I can give is when your thumb gets stuck in the door, you kind of shake it out like that. That's what's happening with these neuromuscular treatments. So if your client has all these underlying problems, you do some retraining of the area, get things to fire better, but those muscles aren't healthy, those joints aren't healthy, you're actually going to expose it in the long run. So 99% of the time, you don't need to retrain the nervous system. When you remove that dysfunction, you build up the strength properly, the area is going to function better. And a lot of those distortions in the posture, the muscles not firing correctly, will go back to where they need to be because they no longer need to protect that area. So I hope it didn't make anyone too upset and think I'm bashing what they do. I'm not bashing what you do. I'm just giving you facts and real data so you can make a better idea of what's going on. Because the key in solving any problem is you need to know exactly what's going on. And I'm very worried sometimes when I see some of these treatments and these protocols where they're like, yeah, we can treat it right away and they have instant pain relief. Here's the problem. If you only improve the symptoms but not the function, it's actually very dangerous. And that's what neuromuscular treatments do. They improve the symptoms and you temporarily do feel better, but you didn't improve any of the tissue. It's kind of like the check engine light came on in the car. You unplugged it, you said, I'm just going to ignore it, and then you kept going, and eventually the car is going to break down even further. So that's all I got for you guys on the video. I appreciate you guys watching. Please share this video with any other providers you know that are really striving to do great work and always open to thinking and treating differently than what is conventionally taught. I'll see you guys on the next one. Bye.